Hi, I'm April. I'm a postpartum RN. I currently am a bedside nurse. I take care of moms and babies, and today I wanted to talk to you about a condition that is developed a lot in pregnancy, and it's called preeclampsia. It's the leading cause of health-related issues in pregnancy. I'm going to talk about what is preeclampsia, who's at risk, what are the symptoms, when to call the doctor and go to the ER, and how to check your blood pressure. So I'm going to start with what is preeclampsia. Preeclampsia is a high blood pressure in a pregnant woman, and also all the way up until your baby is 6 weeks. So you can develop this even after you've had your baby. 1 in 25 women develop this. It is a serious complication that can be harmful for your baby and for yourself, and even can lead to death. So I'm very passionate about educating you guys about this, and so you know the signs and symptoms so you can get your help right away. This is super treatable, and like I said, very common. Let's see, who's at risk? Okay, anybody's at risk. First-time moms especially are at risk. If you've had a family history, if your mom or your sister had preeclampsia in their pregnancies, if you've already had preeclampsia with any of your other children you've birthed, if you're older than the age 35, if you are overweight, let's see, who else? I think I wrote it down. I think that's it pretty much. But like I said, anybody can get preeclampsia. So this is important to every person to be listening to. What are the symptoms? The symptoms correlate with a high blood pressure. So preeclampsia is a high blood pressure, top number 140 and above, bottom number 90 and above. So symptoms are headache that will not go away. Okay, you've taken Tylenol because that's safe to use during pregnancy, and you still have a headache. That is a sign that your blood pressure is high. Pain in your right upper quadrant, they call it area, just basically right on your lower rib right here. If you're having pain that will not go away, that is also a sign. If you're having blurred vision, any sort of vision issues, spotting, starring, blurry, let your doctor know right away. If you have swelling in the face, in the hands, if you have shortness of breath and trouble breathing, that's because you're just holding on to so much fluid that your blood pressure is super high, and so you tend to get short of breath. If you have a decrease in how much you are peeing, and your pee seems to be very dark and concentrated or cloudy, that is a sign. A lot of these symptoms are very similar to being pregnant. This is why it's so important that I want you guys to put on your baby shower registry a blood pressure machine. Okay, they're automatic now. They're super easy. This one cost me $30. I just bought, one of the most popular off of, I think Amazon is how I got it. I didn't go look at all the different ones. $30. So we'll get to that, but that's really important because if your symptoms are correlating with a high blood pressure, that is a very good indicator that you have preeclampsia. Okay, when to call your doctor and when to go to the ER. I recommend that starting at 20 weeks that you take a blood pressure 2 to 3 times a week, just so you know your baseline, meaning you just know how you normally run, and then all the way up until your baby's 6 weeks. If you start having symptoms, that is when you should stop everything you're doing and take your blood pressure. Call your doctor if you do have a blood pressure that's high or if you have any of these symptoms. Now, if you have a blood pressure reading that's 160, the top number being 160 or higher, and the bottom number being 110 or higher, that is severe. We consider that severe. So you need to go immediately to the ER or call 911. This is very important. Like I said, this can be harmful for you and your baby. Okay, let's go over how to take your blood pressure. And if you guys would like, I can go into further detail of how this really starts affecting your body in like a physiology level, but I just want you guys to get the gist so you know what to do. So, very first thing is you have to have a proper size blood pressure cuff. Since I'm not pregnant, I fit into the normal one. A lot of times women, since we gain weight when we're pregnant, we do need the larger cuff. How you measure is there's two little arrows. Every machine is going to have these little markers. As long as your arm circumference, meaning like around, fits on the blood pressure cuff, you are good. Okay, so this one's going to be too big for me right now. This one's the standard size, so I'm going to use this one. Let's see. So it has a little tube. I just press on and it starts going. Very easy. I'm going to open it up. I'm going to slide my arm through. And this is fitting nicely. Okay. Do it kind of tight. This part of your arm, okay, you see where the bend is in my arm? Have it right above there. You're supposed to do it on bare skin. This shirt is really thin and it's kind of cold and I don't feel like getting my shirt off. But you want to take it on bare skin or very, very thin clothing, okay? If you were wearing this for me in the hospital, I would be fine taking your blood pressure with this thin material on. If you had a sweatshirt, I would say I need you to take it off. So you're gonna line up the arrow with where they draw blood. That's how I just remember it, like right here in the crease of your arm. This arrow is a little bit off. Let's see. Okay. So very important when you're taking your blood pressure, you want your feet flat on the ground, no crossing your legs, okay? Proper size cuff, skin to skin, skin on skin if you don't have a very piece of thin clothing on. You also want this to be at heart level, okay? So you're gonna sit at a table, lay your hand out like I'm doing, and you're just gonna take a few deep breaths. Get yourself calm. This can take up to 5 minutes. Just give yourself a few minutes to just relax, okay? And I'm gonna just press start. No talking either. You don't want to talk. Oh, 140/69. Well, I've done a couple run-throughs of these videos. I'm a little out of breath, so that might be why it's so high, but I mean, this would be worth noting and writing down in my log, and then when I show up to my doctor's appointment, I would show her that, okay, that day, for some reason, I was running 140/69. I'm not overly concerned about this because, like I said, both the numbers, 140 has to be above that on the top, and on the bottom it has to be above 90. I'm really hoping that you guys request a blood pressure cuff. That costs about $30 to be on your registry. It's very important. It has the potential to save you and your baby's life. I hope this helps. I hope you are more familiar with the symptoms and what you need to do if you end up developing them. You got this, Mama.